Joining us live from our Abuja studios is a public health expert and managing partner at Rolling Stones Consultancy, Dr. Hamid Adediran. A pleasure having you with us on the News at 10.
Thank you very much for having me. Good evening, VR.
Now, let's begin by getting your assessment of the health sector in Nigeria in the last 1 year under President Bola Tinubu.
All right, thank you very much. The health sector in the last 1 year of the administration of President Bola Ahmed Tinubu can best be viewed as what you see when you go to a site that's under construction and at the foundation level. If you have deep insight, you may be able to appreciate the prospects of the building that would spring up from whatever you're seeing. But at that time, you're not likely to have a full picture of what is currently on ground. So for us, for me, what I see is the way we look at it is you can either say the cup is half full or half empty. I choose to see it as half full. So far, we can see progress, significant progress, which also brings us to asking more questions and hoping that with this we can have some kind of iteration in the coming years of the administration. But so far, yes, the first year, the government is apparently starting on a relatively fair note. And if you look at it from the renaming of the office, the portfolio of being a coordinating minister of health and social welfare, which means that we're beginning to see health as something quite close to social welfare and not just a standalone. Okay. There is a lot more that needs to be done, but starting from there and looking at the renewed hope agenda that was released by the coordinating minister of health and social welfare, Professor Alipate, may I also add that the choice of the coordinating minister and his minister of state look quite impressive and perfect, and we're looking forward to what more we can get out of the system.
So what do you consider the most crucial step to be taken to lift the health sector out of its current state?
Well, for us, there are 6 building blocks of the health system strengthening, and it appears that we are on the track because one of the some of the key important levels are things around service delivery. You talk about workforce, you talk about financing, you talk about health security, and it would appear that the 4 pillars of the renewed health agenda of this government is in line with that. So for us, if you look at, first of all, the issue around workforce, there's efforts going in that direction to train people, and not necessarily the healthcare, the core professionals of doctors, nurses, midwives, laboratory scientists. Now, I appreciate the fact that we're looking into the communities, talking about the community health extension workers, CHIPS. Training 120,000 of them will definitely get us to where we need to go. However, we need to also look beyond what we discuss in Abuja. We need to understand that the health sector is beyond what happens at the federal level or at the national level. We need more commitments from the states because they have a lot of influence. They're quite close to the community. They're quite close to the people. They're in charge of some of these centers at the secondary level and, of course, the primary level. I mean, going at down to the subnational level from the states to the local government level at this time. We should also keep track of what's happening in the private health sector because we have reports that up to 60% of Nigerians seek their healthcare services from the private health sector. So we need to look in this direction as well. But so far, the infrastructural support is looking promising. The funding commitment is also looking promising. But I also have to emphasize that we need to start looking beyond donor funding, international support, to domestic resource mobilization. The Abuja Declaration of 15% should not just be a figure that we talk about every year. Meanwhile, our budgets will sit at 4.6% of the total budget, which is a far cry. And also not even enough, and there's a lot that needs to be done. So we need to start looking at how well we can use our local resources.
Okay, Dr. Hamid, if I may, let's talk about the issue of brain drain. It's a major challenge with so many doctors leaving the country. What can the government do to address this situation? If you can just quickly tell us in a few
the
seconds.
Government is, okay, yes, the government is looking in the direction of increasing the number of intakes at the training level, at the undergraduate level. But beyond this, I also think that commensurate remuneration would be what would help us to get retain more people from considering leaving this country. If you're being paid for the work being done and you feel you're being appreciated and compensated adequately, I think that it will help us in this regard to reverse the brain drain that we're experiencing in the country. Also, maybe we also, as a government, need to encourage our people to see why they need to support the government, promote the sense of patriotism, because this is actually a lot of what determines whether someone decides to stay back or decides to seek for greener pasture to make personal ends meet. So for me, I believe that the government, we're on the right track, but a lot more still needs to be done. We also need to provide an enabling environment. If I work in a facility, in a health care facility, and I don't have all the resources that I need to work with, it can be frustrating, and it can be part of contribute to the push factor that takes people out of Nigeria. So let's have an enabling environment. Let's have the healthcare providers being adequately compensated, and let them be encouraged to stay back. Let them feel happy to be serving their country and providing services such as health, including social welfare for the people. And of course, let's not forget the community, and let's invest in behavioral change so that we can have better health-seeking behaviors for the people. And of course, we can prevent the occurrence of diseases so that people don't get to health facilities when it's rather too late and the healthcare providers have little or nothing to do to salvage the situation.
Okay, Dr. Hamid Adeniran, it's a pleasure sharing your thoughts with us on the News at 10.
Thank you very much for having me.